FUE tools in my experience. There are many FUE tools in the market, and they can be grouped into two main categories, which are manual punch or manual FUE tool and motoring machine or FUE tools that are equipped with electronic systems. Currently, there are 5 types of motoring FUE machines being used in my clinic. One, Safe System, developed by Dr. Artis. This is an electronic FUE tool using dull punch technique. Two, PCID by Dr. Cole is a computerizing-based machine that allows users to set system's spinning cycle either as rotation or oscillation, RPM or round per minute of the spinning cycle, as well as depth of each punch also can be set in PCID system. Three, CDD Vortex is another FUE machine developed by Dr. Cole. This electronic FUE machine also allows users to set preferred depth of each punch as well as the RPM. Four, Safer or NeoGraft system is motorizing machine with suction capability that will suck in hair roots and keep in its container. This type of machine is also equipped with pressure-based implanter handpiece used for hair transplant. Five, the Artis is a robotic type of machine which is capable of collecting or harvesting and implanting hair roots. The grafting capability is now in the development process. With the robotic functions, the Artis can replace most of the human-required tasks, from designing of hairlines, finding hair density of patients, to operation processes so that the robot can perform hair transplanting more accurately and properly. At MHC, we offer all 5 motoring FUE machines. The strong and weak points of each machine are varied but mainly depending on the duration of operation time required for each case, as well as the surgeon's fatigue. 1. Duration of operation time. The Artis claimed that its punching speed is at about 800 to 1000 grafts per hour. We understand that the higher capability claimed by Artis did not include time for changing grid lines and adjusting position of patient. However, based on our experience, the actual speed of Artis is about 400 to 700 grafts per hour. By comparing to other motoring machines capable of around 500 to 1000 grafts per hour on average, however, if the machine is used by a highly experienced surgeon, it will be able to reduce time for each operation case. Also, the severity of the case can impact on operation time as well. 2. Surgeons' fatigue during time of operation. In terms of the performance of surgeons, the main cause that can impact the operation process is fatigue incurred during the operation time. A longer time used for each case will reduce performance of the surgeon. This means that the more supportive tool used will increase the performance of the surgeon. The Artis is the best solution for this case, as the robotic functions can tremendously reduce human errors as well as shorten operation time. However, the robot still requires a highly experienced surgeon to control the whole process for more accurate results. Other factors besides operation time that can affect the surgeon's performance are weight of handpiece and capability of the punching tool. The higher weight of handpiece and type of RPM used for punching tool will directly impact on the surgeon's performance and ability to punch onto patient's hair scalp during operation period. According to our long-term experience, SAFE system is equipped with very weighted handpiece. The punching type of this machine is dull punch, which requires more manual pressing than sharp punch-based FUE tool. Punch types are varied by brand, and each punch type affects the capability to pierce into the skin. According to my experience, it is found that serrated type of punch can better pierce into skin when compared to smooth type of punch head. In addition, the thinner and sharper punch wall will have direct effect post-cut on donor area. The cutting wound will look better and will take shorter healing time by comparing to the cutting wound using thicker punch or dull punch. Graft type also differs by each punch tool used. However, punch tool type does not make any changes in terms of transaction rate. Therefore, the true factor that has direct impact on transaction rate should be the surgeon's expertise. Personally, I started using Dr. Harris's SAFE system, which is very easy to use, but the handpiece is quite heavy, which causes fatigue. Therefore, only Artis would have the type of graft that depends on the patient's hair roots and not the surgeon's expertise. We found that the operation time can be reduced if we can process harvesting and implanting at the same time. This will also require patient to remain stationed in seated position all through the operation period, and it is also based on a case-by-case basis. Once the patient can be in seated position, the surgeon will be able to harvest hair roots from the back of the head and at the same time implant onto the forehead. So for this case, it will require very light-weighted handpiece and high-performance FUE tool. In summary, every tool have their own strong points. A surgeon can make use of these tools based on a surgeon's skills. The Artis is the only robotic type of FUE machine that can replace and reduce the human process. However, besides using the proper device, the best results of each case are mainly relied on the skilled hands and highly experienced surgeon and nursing team. In addition, at my clinic, we are also using pre-made incision and implanter for hair transplant. This method will also help to reduce time and damages to grafts, which means this will higher the surviving rate of the grafts tool.